Thank you for joining us this afternoon. We know you're all busy and it's much appreciated. Just a reminder, the Hub is run by volunteers, we're non-political and we're led by lived experience. And for those of you who don't know us personally, we are three friends from Caithness and we all have gynae conditions. Kirstine has endometriosis and was born with a bicornate uterus. She's had a hysterectomy, cervix removal, and is due to have her 14th surgery in a few weeks. Claire has pelvic congestion syndrome and has had a radical hysterectomy and ovary removal last year, following a laparoscopy a few months beforehand. My name is Rebecca. I have endometriosis and PCOS. I'm at the start of my fertility journey at the moment and I'm waiting for the fourth surgery in 5 years. We are passionate about bringing care closer to home for all women of the North Highlands, and we run 4 private support groups which cover Orkney to Inverness. I am delighted to see we have so many voices in the room today, and I look forward to hearing from all of you later on. Women's health in the North Highlands is multifaceted and it's a complex issue, but we're hoping today to bring some views from all sides of the fence to the table. I will be running us through some of the major points surrounding the current situation today. At the end, we will have loads of time to discuss how to create positive change and talk through anything that's not mentioned in the presentation that you would like to discuss. Essentially, we would like to leave today with some idea on how to improve the service for the better that works for everybody. A note on human rights. We're very lucky to have a good relationship with Making Rights Real and also the Scottish Human Rights Commission. They keep us straight with what rights we should be defending and which rights Scotland has sworn to uphold for its citizens, rural or urban. The World Health Organization is very clear on the foundations of what healthcare must look like. It must be effective, efficient, accessible, safe, affordable, and patient-centred. Scotland has also signed to uphold many conventions, but today we'll be mostly focusing on CEDAW and ICE-SCR, which are both United Nations human rights documents. Now, I want to briefly touch on maternity. We are in agreement with other concerned community groups that something has to change for mothers to be of Caithness. The current model is not safe and it breaches human rights, not just the rights of the mother and the child, but of other patients attending A&E, which is where the majority of babies who were born in Caithness last year came into the world. Imagine being a woman with endometriosis or PCOS or has suffered a miscarriage or has been told she's infertile. And now imagine laying in A&E in a bay beside a labouring mother. It's really not great, is it? However, we'll be focusing on gynaecology today because not all women will need an obstetrician, but almost all women during their lifespan will need a gynaecologist at some point. Moving on to our first set of considerations, which is geography. Back in 2016, when the Caithness General Obstetrics Unit was downgraded to a community midwife unit, Wick Community Council raised concerns. These were that if obstetrics were to be centralised to Raigmore, what then would happen to gynaecology? And would the majority of patients now have to travel to Raigmore for care? NHS Highland at the time responded by saying, "We will always try to balance how we can make best use of resources to provide safe services with minimising travel for patients." Now imagine your daughter, your wife, mother, grandmother, sister or niece has just gone into hospital in Edinburgh with terrible pelvic pain. She is told that she can see a gynaecologist, she can be admitted to the gynaecology ward for observation, pain management, scans and care. You think, great, let's do that. Now they tell you you have to hop in the car and drive her to Newcastle for this, and that is routine for women in this situation. How would you feel, and would it be acceptable? Sometimes this distance on far worse roads is the journey that women make regularly for care, whether that be a 5-minute outpatient appointment or whether it be emergency care from a gynaecologist. And that's in the hope that they actually have a bed for you when you get there. It's not to say that the staff in A&E and Caithness are not lovely, they really are, but they're not gynaecology nurses, nor are they gynaecologists. Now, these numbers won't be unfamiliar to most of you. But it's just a quick recap on the travel issues facing women accessing care. So toilets along the route, especially if you live inland, are few and far between. And recently, many of the public toilets, including disabled toilets with radar keys, have been locked due to tourist vandalism. The road is very twisty and currently in a really bad state of repair with potholes and very rough surfaces. And the weather is becoming more and more extreme every year, thank you to global warming, and Caithness is being closed off by road more and more commonly through the darker months. The two pictures you can see in the slide here were both from early this year and late last year. During the summer, the roads are busier than ever with NC 500 visitors, camper vans, and many cyclists. Unfortunately, we have seen a sharp rise in closures of the Keswick Bridge, with troubled souls looking to end their lives. And although this is tragic, it does, however, add on around another hour of detour and delay to a very arduous journey to hospital. And it's really not uncommon for outpatient clinics in Caithness General to be cancelled because the visiting doctor can't make it up due to weather or travel disruptions. It's really quite simple. If it's not safe for the medical teams, then why is it safe for patients to travel the other way around? Scotland has sworn to provide health services as close to people as possible, especially in rural areas. And that leads me on nicely to some findings from last year. Throughout 2022, over 50% of women under the care of gynaecology who live in Caithness had to travel to Raigmore for their outpatient appointments. When there is a perfectly good hospital in Caithness, it seems bizarre that so many are travelling so far for routine care. And although near-me sessions are being used occasionally, they don't offer the same opportunity for physical examinations in clinic, which are so often vital in gynaecology. Now, this is not a new comparison for some of you, but for those of you who don't know, Scotland has extremely strict rules on how animals can be transported when sick or pregnant. Any journey over 62 miles is classed as long in livestock terms. Now, surely sick and or pregnant women should be given at least the same standard of care in Scotland, if not higher. And currently at the moment, residents of Caithness and some of Sutherland are not included in this. Moving on to diagnostics and emergency care in Caithness. Kirsty and I were lucky enough to hear, speak and discuss all things gynaecology with Dr. Matthew Leonardi at the World Endometriosis Congress in May. Matthew is a world-class gynaecologist from Canada. He's also a sonographer, so he has a unique view of both career sets. During one of his lectures, he hit the nail on the head by saying that pain does not always equal danger. However, you cannot accurately rule out the danger without finding the source of the pain. We don't have X-ray eyes, folks, and please bear this in mind as we move forward through the slides. It does have diagnostic imaging, and during the office hours, it's fantastic. The team are lovely. We have X-ray, CT, and ultrasound available to us. Unfortunately, however, for the vast majority of the week, these services are not available. Outside the times of Monday to Friday, 9 a.m. to 5 p.m., all patients of all ages, all genders, are sent to or have to make their own way to Raigmore for scans. Remember the lovely Dr. Leonardi? This situation is not safe in our opinion, and in our opinion, anywhere else in Scotland, only having scanning facilities for 23.8% of the week would not be tolerated. And also the UN are quite clear on the rights of geographically close reproductive healthcare. Just a reminder, Scotland has sworn to uphold these standards. And it's also asked to provide services designed to and minimise and prevent further disabilities. If we can't see what's going on, you don't know what damage is being done. A fine example of this is our first lived experience. A woman with endometriosis, fertility conservation worries, attended Caithness General with severe pelvic pain, suspecting a cyst rupture. She'd felt unwell for several days beforehand and knew that something wasn't right. The junior doctor ordered blood work and had an ultrasound organised for the following day, as the patient had arrived after 5 p.m. on a weekday. The patient was told to go home, take some paracetamol, and come back if infection was suspected. The X-ray department would ring her in the morning for a time to attend a scan. The next day, she was told it would actually be 4 weeks for a scan in Caithness. However, she could make her own way to Rigmore, be admitted to the gynaecology ward, have pain management and immediate scanning. Unfortunately, at the time, the patient couldn't attend Dragmore due to transport problems and car maintenance, and also the pain was sheer too much to sit in the car for 3 hours on a bumpy road. She booked a private MRI, and when she felt well enough, she travelled the 400-mile round trip to Edinburgh the following week. This is the nearest private MRI that we have. The MRI showed that the right ovary, the fallopian tube, and a large cyst was adhered to her uterus. The ultrasound that she finally received 4 weeks after attending A&E also showed a cyst on the right ovary. She's now under investigation for fertility damage and fallopian compression. The maddening thing about this lived experience in particular is that the CT scanner in Wick would have solved all of this hurt and pain. The raw truth is that no gynaecologist was there to order the scan, and therefore it never happened. But you might ask, do we really need out-of-hours services in Raigmore, in Caithness General, with it being such a small area? Yeah, we do. Almost exactly half of attendances to A&E in Caithness General last year were in the out-of-hours, with 49.1% of all patients of all genders attending out-of-hours, and the weekends pretty much matching the rest of the week. Care shouldn't be a 9 to 5 Monday to Friday job. Those jobs don't exist anymore, and we need to be having the same level of care as the rest of the country, seeing as we all pay the same taxes. Now, when we break that down even further into the 24-hour clock, as we have with this example, using data from March this year, we can see the weekends are just as busy as the weekdays, and the evenings are just as busy as the daytimes. Women make up 60% of attendances with abdominal or pelvic pain to Caithness General, and this data is throughout the whole of 2022, with 60% of people attending being female. Less than 5 of either male or female patients were scanned upon attendance, which, as most of you know already, can be anything between 0 and 4 due to the Freedom of Information request rules. Interestingly, though, despite women making up the majority of attendances, far less were admitted for further care than men. Now, we know this may be down to men having more serious presentations at the time. However, even taking that into account, the numbers do suggest that women are being sent home or to Raigmore for their care more often than men. A recent poll in our endometriosis support group showed that 90% of women who answered the poll would not attend A&E due to either not being believed about the severity of their symptoms, or that A&E does not have a gynaecologist and they're quite often sent home just to self-medicate. Only 6% of 50 women said they have a good A&E and they would attend, and they all lived near Inverness. As stated in CEDAW, Scotland has signed to eliminate discrimination against women and provide equal access to healthcare services. Shockingly, 2.4% of women who attended Caithness General in A&E with abdominal or pelvic pain actually physically hands-on saw a gynaecologist at the time in the last 5 years. Now, this breaches so many human rights, but mostly the access to adequate reproductive health care, equality of men and women, and a respect of human dignity. Now, the Lovely Air Ambulance is fantastic, and we're all in what they do, but they do have limitations, such as the fact that not all patients fit the criteria to fly, especially if they're unstable or if they have a certain conditions during pregnancy. The aircraft may or may not already be on call. There's a finite number of aircraft that have to be used across the whole of Scotland. Weather conditions such as poor visibility, a lack of medical staff to travel with the patient if they do need to go with them for Regmore, a lack of de-icing facilities at Wick Airport, especially during freezing fog and ice, transfer that might not be quick enough, or it could be delayed if the unit is elsewhere first. And loved ones also have to travel by road, which is not only a lonely and stressful situation, especially in bad weather. This is also a dangerous situation. Your mind is elsewhere and you're probably driving too fast. Now on to beds and staffing. Gynaecology staffed beds have reduced in both Caithness and Regmore, with Caithness shockingly going from 285 staffed gynaecology beds per quarter to none in just 9 years. Now, common sense would say that if you have less beds in Caithness and you have the same number of women needing care, the beds in Regmore should then be increasing. But unfortunately, that is just not the case. NHS Highland currently provides the same total number of beds for gynaecology that Caithness used to have alone for obs and gynae. Women's health in the North Highlands has been neglected consistently, and the Regmore team are now under immense pressure to treat women from all areas of NHS Highland using only 8 beds and 1 emergency bed. When these are full, patients are then scattered throughout the hospital wherever beds can be found. This is a breach of the staff's human rights as well as the patients. And it really doesn't matter how many times I look at this ratio, it really does take my breath away. If you assume the emergency bed is in use 100% of the time, and the number of gynae beds is now available to women between the ages of 15 and 90 plus in the NHS Highland, that leaves a ratio of 1 bed to every 11,467 women. And I'm no medic, but I simply cannot see how this is safe. Scotland has also sworn to allow unhindered access to sexual health services and reproductive health services. And I cannot see a world where there isn't always beds in use, and that to me is unhindered. Now, since 2017, procedures in Caithness General have also been reducing for gynaecology, with a clear trend of less and less each year, apart from that pointy little bit that's the pandemic where everything stopped. We have gone from 3 gynaecologists working in Caithness down to just 1, with occasional cover from Orkney and Inverness. And that being said, this cover is for surgical and clinic time, and there's still nobody for emergencies or out of hours. Another reminder, the Scottish public authorities are obliged to avoid any practices that discriminate against women. The impacts of these centralisations over the last years and downgrades are wide-reaching, including financial, emotional, physical, and economical. We put out a public survey, which was an anonymous response and had over 250 responses. When asked how travelling to Regmore for care made women feel, these were some of the most common answers. Most of them were repeated. Unfortunately, these accurately reflect what we hear from members of the public all the time. And trust us, it's not a reflection on the staff at Caithness General. They can only work with the system and the training that they have. And I'm sure they don't feel great about having to send most of their patients away or to send them down the road to Regmore all the time either. Although NHS Highland does offer a reimbursement scheme, the money then still has to be paid for accommodation, fuel, travel, healthcare, childcare, food and drink before any of it can be claimed back. 17 pence per mile for fuel, 17.17 mile per mile for fuel, and £50 per night for accommodation is what you will receive realistically in a few weeks' time once you've claimed the cost back. If you happen to be in Regmore at the time the cash office is open, you do get the money back instantly, but the cash office has very limited opening hours and the cash office in Caithness is now permanently closed. You are then docked from this amount £10 if you are not on any benefits. The average cost of a hotel stay per night in Inverness is now £240 a night, even for basic accommodation. Cheaper B&Bs are often not disabled access friendly, which does rule them out for many. And Kyle Court, Raigmore's patient and family accommodation is often full or not available for outpatient appointments. Using up your annual leave for unnecessary travel to hospital, often 2 or 3 times a month, eats away at quality of life. Those days cannot then be reused for rest, relaxation, and family time. And not everybody has access to sick pay. Another thing to mention here is not everybody has the ability to travel and take the time out from work. Caithness especially has a high level of farming community, and you cannot just suddenly leave all of your animals. If people don't have access to someone to cover for a couple of days, plus all of the money to spend on the accommodation, then a lot of the time they just do not go, or they can't access the care. Unfortunately, the reality is that women now are choosing between feeding their families or attending appointments in Raigmore. Now, in any country, that is not good enough, but in a first world country like Scotland, it really is downright shocking. Scotland has sworn to provide publicly or privately provided sexual and reproductive health services that are affordable for all. I think we can all agree at the moment this situation is not affordable. We are also seeing women frequently turning to private healthcare in either Glasgow, Edinburgh, or Aberdeen due to desperation after waiting for so long on gynae lists for treatment. Raigmore is overwhelmed with patients, and the waiting times reflect this. We've also seen quite a lot of cancellations of operations either on the day of or the night before, when annual leave and a mental health situation has got, you've got yourself psyched up and got yourself into this space for going in for an operation. You've put everything in place, you've made the meals, you put them in the freezer, you've got the kids sorted. You get there, you're sitting there, and it gets cancelled because there isn't clinic space or there isn't theatre space. And that's just simply not acceptable. It's happening far too often. Some women are now taking out bank loans or remortgaging their homes to pay for private care, up to the value of £10,000 per go in some cases. But to be able to pick the date and know when you're having the surgery and know it's going ahead, some people are choosing that choice. Now, economically, the whole area is being impacted by families, couples, and young professional women leaving the North Highlands or simply choosing not to come here. This is purely based on the lack of gynaecology care close to home, and this will inevitably include medical staff who would otherwise move and fill the open positions at NHS Highland. It's a beautiful place to live. The impact on the local economy is an unspoken disaster, and it will only get worse if gynae is not reinstated very, very soon. Even local women born and bred in Caithness say they don't feel safe anymore, and all 3 of us will attest to the fact that we get stopped in the street and people say, "More power to your elbow, keep pushing for change," because we're close to putting the house on the market. So what do those Highland women want, and what are we pushing for? So we met Humza Yousaf last year before he was sitting in his big boy chair back in August, and he made it very clear that something had to change, and something had to change soon. He said something is clearly wrong here, and we obviously need to do something to change it. Well, that's big talk, but let's discuss later on exactly how that change can happen and how quickly it can happen. So this is what we would like to see, and let's go through this point by point, starting with those waiting times. To reduce those consultants' waiting times and lists down, to make care more accessible, we would like to see 2 advanced nurse practitioner roles for gynaecology, which cover Caithness and Sutherland. They are highly trained professionals who are perfectly capable of taking on a caseload, which would ease the stress on Raigmore a huge deal. We desperately need to see out-of-hours emergency scanning become available for Caithness General, and installing an on-call rota, or ideally staffing the unit for more hours of the day, is a solution to this. The lack of an on-site gynaecologist for emergency patients is a concern. We would like to see on-call element added to the gynaecology consultant contract for Caithness. And on top of this, A&E staff would perhaps benefit from more advanced training on women's health. We would also like to see more willingness to admit for gynaecology issues and pain onto the ward for management. Trust us when we say no one wants to be in hospital, but if it's medically necessary, then it should be available close to home, not always in Regmore. When a woman has had consistent pain, especially for several days, you can trust us when we say they have tried everything in their arsenal before they've hit the hospital door. They have tried paracetamol, hot baths, heat patches, stretching, voodoo, whatever you want to say, but they have only come to the hospital out of the end of their tether desperation. For them to then be turned away and told to take paracetamol or to travel all the way to Regmore for some care, the effect on the mental health of our women up here really is going unnoticed. And discharging patients after operations, mostly from Regmore, sometimes on the day of travel, is not safe. We would like to see an increase in gynae surgical procedures in Caithness General, and we are also working with NHS Highland to create useful safe travel packs for those patients who are leaving Regmore and travelling home. And then finally, we would like to see gynaecology return in a fuller capacity to Caithness General. The EQIA in 2016 only ever took into account maternity, not the impact on gynaecology patients. And Near Me is a very useful system for follow-up appointments, but it's not always offered. And if that could be increased, it would reduce a lot of travel to Regmore or even to Wick. It's not all doom and gloom. Slowly, we are seeing the situation being taken more seriously by the powers that be. NHS Highland have agreed to do an EQIA on the gynaecology situation here in Caithness. They are also starting a review of the whole gynae service across the NHS Highland region, the results of which should be ready in a few months. The petition we filed in January 2022 is still very much open and sits with the Health and Social Care Committee in Parliament. They are awaiting the results of the NHS review on gynaecology before they decide how to proceed. As we said at the top of the presentation, we are in communication with human rights organisations to ensure that any changes going forward have a positive effect on women's rights rather than a negative impact. Thank you ever so much for listening, and special thanks to those women who have trusted us with their lived experience to help us try and achieve positive change. The virtual floor is now open for friendly and constructive discussion on how we can move forward and what to aim for to improve the situation for everyone. Please do try and keep your points brief to allow for all voices to be heard. There's quite a few of us today, and we will aim to finish at 5:30. I'll hand over to Claire and Kirstine to start the conversation off, and thanks again for attending.